MobilizationTuzzolino, and this is mobilization of the upper extremity for PT 825, manual therapy for the extremities. This is my patient Deb, and as in the patient scenario, she has a painful elbow and a stiff shoulder and wrist. So we're going to go through some mobilizations. I'm going to start off with the shoulder and try to loosen that up a little bit. I've got her in the open pack position where she's got the most amount of play. This is going to be an anterior posterior glide, so I'm coming right in here. And if I was going to start with her at her point of resistance, so she's kind of limited right here to about 90 degrees of abduction, so I'm going to come right in on the joint. Not really going to have any problems or issues with the first two grades, but I'm going to go right ahead and go into the third grade 3, which is large amplitude all the way through in the resistance. And then, since I've got her at the point of resistance, I would do a small amplitude, grade 4, into that point of resistance to try to gain range in the shoulder. Moving along to an inferior glide of the same glenohumeral joint. Again, I've got her open pack position here. I'm kind of assessing the play that she has in that joint. She's got some restriction here in her internal rotation. So I'm going to position her in the scapular plane. I'm going to rest her leg here, or rest her arm on my leg, and she's restricted to about right there. So I'm going to kind of come in here, and I'm going to do again, grade 3, and a grade 4, keeping her and trying to kind of help out a little bit with this into that motion of internal rotation, and she's in at the small amplitude grade 4, like so. Okay, and additionally, so a third mobilization we can do for that for the glenohumeral joint is we can also do an inferior glide, not just for the internal rotation, but here at abduction. So she's restricted to 90 degrees, so I come in and do the same thing. So my vector force again is down, caudad, inferior, like so. And I got her at her point of restriction, coming in here. Again, she's stiff, not painful, so I'm going to go with grade 3. So a large amplitude to that resistance, point of resistance. And then at that point of resistance, I would do a small amplitude, grade 4. Okay, and then a fourth one I think was a nice one to do. I'm going to have Deb turn onto her side, and I'm going to come right into her shoulder blade and do scapulothoracic mobilization. I'm on her inferior border of her scapula here, with this hand up here, and I'm just going to do, you can do cephalocaudad motion, you can do protraction, retraction, but I'm going to get in here like this, and I'm going to, again, after going with my through motion, I'm going with a 3, so I'm going in that large amplitude, and then I'm going to hold her at that end point and do a small amplitude, grade 4, and a point of resistance. Okay. We're going to move along into her elbow. Her elbow is a little more painful. I'm going to start off here with just a gentle kind of seeing where she is position-wise, how much she's got here. She's pretty limited. So we're going to try to go and kind of increase that elbow flexion. So we're going to go right on her joint line here. This is kind of combining a distraction with a physiological flexion. So I'm kind of trying to scoop that olecranon into the fossa. So I'm going to, again, here in the joint line, and just kind of try to do a little retraction and then bring her into flexion. A little retraction and bring her into flexion. And that would, not really graded, that's more of a physiological motion there, but I suppose you could do a grade, just a gentle grade 1 or 2, because again, she's painful, so we're looking for things that are going to help with her pain. Then I'm going to go to a the elbow pronation mobilization, so trying to get her a little more pronation there. I've got my head on the humeral, I got my finger on the humeral head, and I'm just kind of gently kind of spinning her into pronation there. She would be pretty limited probably, so it would just be a little light like so. It's more of a physiological motion there. I'm just kind of giving her a little compression at the head of her radius. Okay. I'm going to skip along to the wrist and then come back one more to the elbow so I don't have to have Deb move around so much. So we're moving down to the carpal. So we're looking at the carpal joint here. You can do it on the dorsal surface or the volar surface. So between her radial ulnar joint and her first row of carpals, we're a little bit below that because we're doing the carpals themselves. So we can kind of do them all. I like to do here is to do the individual. So I'm going to stabilize and do it. So the same thing again. She's just stiffen her wrist, so we can do that large grade 3 mobilization, or at the end of the joint, end of the resistance, that small amplitude grade 4. Okay, and her wrist. We can stabilize. Okay. Then we're going to go to wrist flexion. So that's here on the volar side of her wrist, and we're going to, from the this is the ulnar radial joint, distal ulnar radial joint in the proximal carpals. So I'm just kind of pushing down and pulling up, down and coaxing up. Okay, that's for wrist flexion. So again, you could do a grade 3, large amplitude, and where her restriction is, you could do a grade 4. And then to do wrist extension, we would be on the dorsal side. Same idea. I'm just going to be kind of down and bringing it up, down and up. I'm mobilizing down, gliding up, mobilizing down, gliding up, and again, large amplitude, grade 3, and small, grade 4. And the final one I want to do for her elbow, I want Deb to be on her tummy, and I'm going to use my little wedge. And we're just switching to her left arm here for the sake of time, and I'm going to get some right on her olecranon here. We know that the wrist goes into supination as we extend, so I'm going to be right in on her olecranon and try to kind of guide it into that position and do a little gentle supination. Again, she's painful in the elbow, so this would be more of a gentle, grade 1, which is small amplitude at the beginning of the range, or a grade 2, which is a larger amplitude at the beginning of the range. How you doing, Deb?
Good, thanks.
If she was heard, if she could tolerate it and it was going okay, then I could maybe go a little further into that range, like a grade 3. But per the chart, she's pretty painful, so we're just kind of sticking with that grade 2, which is the large amplitude into the range, and I'm going to be trying to kind of coax her a little into supination here, and just that first, which is the grade 1. Okay, and that's it. Thank you.